Hello and welcome to this Langford Academy video series. I'm Emma Gatehouse, the Behaviour Resident here at Langford, and I'm here alongside my supervisor Sagi, who is a European and American specialist in veterinary behavioural medicine. In this series, we're going to be talking about the relationship between physical and emotional health in companion animals. We just wanted to say a big thank you to Siva for sponsoring this presentation.
Hello everyone, my name is Sagi Denenberg and I'm a veterinary behaviorist at Langford Vets. In this first video, we're going to talk about how behavior is important and why is it important for clinical services that we provide and how to integrate physical and behavioral interplay to identify how the animal behaves, feels, and acts. So why does it matter? Why do we need to know about behavior? First, behavior reflects anything the animal is doing, the way it moves, the way it eats, the way it sleeps, the way it interacts with the owner and with the environment. Behavior is the first thing that you see on the outside. Behavior is the first thing that owners see on the outside and report to you, the clinician. Any changes, such as metabolic diseases, pain, even neurological diseases, can alter the behavior output. And that's what you see. That's your first and earliest clinical sign. Behavioral signs represent a full range of pathologies that will later develop into a full clinical disease. Therefore, integrating behavior with medical findings allows us to do an appropriate diagnostics, identify the cause of the problem, and to treat it accurately. When they come to the veterinary hospital, we need to have integration of all staff members to help us. That could start with reception staff that sit and observe the animal in the reception area, nurses that triage the animal, talk to the owner about things that they see at home, and of course later the clinician within the consulting room, examining the animal, observing the animal, interacting with the owner, with you, and moving around. This way you get more details and you can have a full integrative approach to diagnosing the problem. Each visit should start with full behavioral observation of the animal in the room and asking the owner about the behavior of the animal at home, because sometimes they won't behave the way they behave at home at the clinic because of stress, because of anxiety, and because of presence of other people and other animals. So it's important to incorporate both the behaviors at home through owner's observations, whether it's videos, whether it's owner's descriptions, and what you see later in the consulting room. Now, the first thing to remember is that we need to ask the owner what is normal for that individual animal. The behavior that you see is not an absolute. If, for example, you can have an animal that is very active at home, playful, and suddenly not playing anymore, not active anymore, but you can also have the opposite. You can have an animal that wasn't very active, mostly sedentary, mostly resting, that becomes very active, walking, pacing, exploring. So it's really important to ask what was normal for that individual animal and where are the changes now. There is no absolute that it must be overactive or it must be inactive. You always have to compare it to the animal itself. These are just common examples that we'll break in later videos into more details. We'll cover how pain and sensory loss affect behavior, increases irritability, possibly aggression, and can cause withdrawal behaviors. We'll discuss metabolic diseases, whether it's hepatic, renal, and we'll discuss also electrolyte imbalances and how they affect behaviors. Of course, infectious diseases, FIP, FELV, distemper, etc., and hormonal diseases like hyper or hypothyroid, hyper or hypoadrenocorticism, and other hormonal diseases that will influence behavior. Remember, behavior is your first and earliest diagnostic tool. So identify how the animal behaves now compared to how the animal behaved in the past. That goes for observations, that goes for questionnaires that you can ask the owner to fill in the exam room or fill while they're waiting, or you can send the questionnaires home so the owner can fill it and email it back to you before the visit so you can go through them. And I tend to use very simple questionnaires with a lot of yes and no answer and ask the owner, is your animal eating normally? Yes or no? Is the animal sleeping normally? Yes or no? And as long as the owner answers yes, I don't need to read the question. But as soon as the owner answers no, then I will read the question. No, my animal is not as active as before. no, my animal is not sleeping as well as before. That allows you, the clinician or your staff members, to go through that questionnaire rather fast without spending too much time on it and focus on what's important. Of course, the next step is to have your full medical examination, any laboratory testing that may require, any imaging that may require, and then you combine all the data you collected through your medical examination and the data you collected through your behavioral observation and assessment, and you can reach an accurate diagnosis. It's important to be able to evaluate whether the pathologies that you're looking at are behavioral in origin, that affect the physiology of the animal, or the opposite, physiological changes that affect the behavior of the animal. For example, you can have diseases that alter neurological function, alter neurotransmitters in the brain, alters hormones in the brain, or even the physiology of the brain, degenerative disease, infectious diseases of the brain, trauma, for example. And all of those will have a direct effect on the animal's behavior. Of course, you can have indirect effect. That could be diseases outside of the brain, renal disease, cardiac disease that will affect perfusion of oxygen to the brain, diseases that will affect hormones to the brain, diseases that will affect the glucose metabolism in the brain. Of course, you can have toxins, and you can have trauma elsewhere in the body, for example, pain, broken leg, that will affect how the brain works, because now you have to adjust to walking on 3 feet, or you have to adjust to avoid certain behaviors, or reach in certain places, such as jumping to a high perching place to sleep. And those, of course, will influence the behavior. So understanding how those mechanisms work together and how they influence the problem, the behavior, allow us to reach appropriate diagnosis and also decide whether it's behavioral primary or physiological primary disease. Now, disease can affect behavior by altering the stress response. That's the way the body reacts to stressors from the inside or the outside. It's the way your parasympathetic and sympathetic system responds. It's the hormonal system, starting with the pituitary and going down to your adrenal gland for your adrenal-pituitary axis and producing cortisol and producing endorphins and adrenaline. On top of that, we can have the environment influencing the behavior, and we can have epigenetic mechanisms that influence the behavior and therefore how the animal acts later within a given disease. Remember, you always compare the animal to the animal. You never compare to an absolute. Now, I mentioned earlier that behavior could be the first and earliest indication. So this is where asking the owner for subtle changes and asking them for acute changes. The dog that used to be active and suddenly the dog is reluctant to jump. Well, that can indicate pain, for example. You can have house ulling in a cat that started due to cystitis. You can have, for example, a dog that starts showing aggression over food as a result of diabetes with hyperphagia or possibly with steroid use. And those would be sudden changes that we need to ask the owner, and we need to evaluate the environment, and we need to evaluate changes in the routine of the animal. And that will help us understand if the house ulling that we are looking at is a result of a disease or a result of primary behavior problem. In many cases, we are facing diagnostic dilemma where an animal comes and the owner complains about a behavioral change. The question is it a primary behavioral change? Is it primary physiological change? Or is it a combination of both? As an example, we can take a cat that develops cystitis, and as a result, every urination in the litter box leads to pain. So the cat starts avoiding the litter box because of the association between litter box and pain. Now, the cat still needs to urinate, so they may go elsewhere, and they urinate elsewhere. There is also a feedback mechanism that once they urinate, they feel better, and it reinforces the idea that urinating elsewhere might be a good thing. So there could be a learned habit, even though you may treat and solve the cystitis with antibiotics and pain control, possibly different diets. The cat still has the habit of, if I go to the litter box, it might be painful, but if I urinate elsewhere, once I'm urinating, there is positive feedback that I feel better, and they start urinating elsewhere. In cases such as this one, we would have to end up with treating both the primary physiological disease, the cystitis, and the behavioral disease that happened as a result of that. So in some cases, you would have to integrate both. One is not enough. Now, in the next video, we will be talking about the effect of stress have on physical pathology, and we explore some specific effects on different body systems.